Okay. Hi, Dr. Reed and Chantel. This is Chris Patelli doing my clinical reflection video. If you see me looking over here, I just have my worksheet up on my monitor. So starting off, some of my strengths over my clinical rotation I did for OB. I think I was really good at providing patient and family-centered care. I got that a lot on my feedback from my preceptors as well as from my clinical scholars. Uh, I think as a student, we're kind of given more freedom and leeway to step back and observe what's happening in a patient's room, both during like normal care, but also times of high stress. Um, so, like while nurses and providers, etc., were working on tasks, maybe tasks that I wasn't able to help with because of the situation, I was able to kind of take time and explain the process of what's happening to the patients, their family, and genuinely felt like they all really appreciated it. Specifically, there was like a postpartum hemorrhage we had, and I was actually holding the camera for the father who was in California for the mom, and she ended up having PPH, and I was able to kind of take time and explain to them what was happening and got some really good feedback on that. I think that was a strength of mine. I also think that I kind of approached each situation with a lot of curiosity and kind of a growth mindset. This is a skill I think I've always had, but I'm okay with asking questions. I think sometimes people can be nervous about that. And so I approached each interaction in my clinic with curiosity, kind of a view of growth. I asked a lot of questions, expanded my knowledge, and I generally felt like I was a more effective nurse by the end of my clinical rotation than was when I started, and was able to be more helpful. And that kind of feeds into my last kind of strength I had, which was self-sufficiency. I think I worked pretty hard to anticipate the needs of my patients, their nurses, my preceptor, and also the care team. And in doing so, I was kind of able to be helpful instead of just kind of being a student that's there to learn and taking a lot. I think I was able to, in several instances, actually make care easier, anticipating needs, helping clean things during the birthing process, stuff like that. And I think that was really good. My weaknesses, I think these are probably really common weaknesses of a lot of nurses, especially this first one, which is time management. I didn't necessarily, especially during L&D, have a lot of responsibility in managing time. It was a lot of kind of going along with my preceptor and helping them. But I did notice that I kind of lost track of where we were in the shift, what time it was, what time we did things, what time the next thing was done. I was so busy kind of absorbing everything that I think I was missing just the normal organization of the day, which is kind of a similar thing that I've experienced in other clinicals. And when I bring it up to a lot of nurses, they say that that's pretty common and something you kind of get better at. And so that was one of my weaknesses. And then the other one was just kind of med admin and pump programming. Not so much like being able to successfully do like the 8 rights in that process. I can definitely do that. I think it's more like discomfort in navigating the electronic process for both pulling out meds, scanning it in, administering it to the patient, remembering to scan their bracelet. I kept forgetting to do that and then having to walk back and do it. And then also kind of like I still feel probably a little dicey on like programming pumps, calculating rates, just like that whole process. Which hopefully is something I'll kind of improve on over time. So for my SMART goals, I did time management and med admin, obviously. So for my time management, specifically, so I'll do like each one of the sections. I will create an itemized nurse's brain and specifically list out each task I plan to complete throughout my shift. This brain will be fully complete in at least 4 out of the 6 shifts per period. That's almost the full SMART, but I'll finish the rest of them. From in terms of being measurable, I will cross out each task as I complete it. That way I can like look at the end of the shift and make sure I have or have not done these things in my nurse's brain. In terms of being achievable, I mean, I'm already going to be using a brain. I'm already going to be using that to go through it. And so just making sure I use it more effectively is going to be pretty, I think, achievable. And for the same reason, probably realistic. And then I will break it up into pay periods and try to improve on each subsequent period in terms of it being time bound. So every 2-week period would be a way to do it. So for my goal, I will create a fully complete and organized nurse's brain for at least 4 out of the 6 shifts per pay period. And then ways to go about doing that, researching nurses' brains that are more effective for me, utilizing mentorship, and also just giving myself self-understanding that time management's hard. For my next SMART goal, I'm going to go fast. I'm running out of time. I'm going to do med administration. I will essentially, for being specific, I'm going to verbally state the 8 rights of med administration for each process. I have them listed there. I'm going to use my nurse's brain to measure it, and I'll already be doing that, so I'll know. I'll check off each time I give a med and I use the 8 rights verbally. I think it's going to be achievable because I'm going to already have a brain. Realistic because I'm going to be giving meds. I'm going to be doing that anyway, so just saying it out loud should be pretty realistic. Time bound, I'm going to make it the same thing per pay period, so for a 2-week period. So for my goal here, for 1 2-week period, that's the pay period, I will verbally state the 8 rights of medication administration and notate it on my nurse's brain for each medication given. I'm going to do that by arriving 30 minutes early and making sure I fill out my nurse brain before each shift. I'll explain to my patients why I'm doing this so it's not weird, and then I will speak to a senior nurse about mentorship and best practices around the process. Okay, cool. Got 10 seconds left. Thanks for everything this semester. It was really great. You all were good, great professors. I learned a lot. Looking forward to seeing you all out in the field. Thanks. Bye.